Hello all, this is Dr. Shilpi Reddy and we're going to talk about different types of female sexual dysfunction. And one such type of female sexual dysfunction is, sexual arousal disorders. When we have to talk about sexual arousal disorders, it means that the desire for having sexual intercourse and sexual activity is intact, but then there are difficulties in arousal. When we have to talk about the reasons behind difficulty in arousals, we have to know what is actually the problem in her getting the point of arousal. In such problems, we have seen a lot of issues in the women having their own blocks. So whether it is thoughts or physical blocks or mental blocks, it can be because of relationships, it can be because of other issues or compatibility issues. They do have blocks and thoughts that do not permit arousal with the sexual partner. Now this again becomes an issue in the act of getting aroused during a sexual activity. It can be that she has a different kind of fascinations and different kind of opinions about sexual activity and she's not able to get to it. And these kind of problems do come when women also are dealing with depression and antidepressant medications. So in depression and antidepressant medications also, there is a component of arousal disorders also. Depending on the antidepressant medications, some antidepressant medications do cause a lot of low sexual desire. Again, some antidepressant medications in fact the process of depression itself can cause low sexual arousal disorder. This can also be the result of expectations, and women especially when they have expectations about performance, expectations about the spouse, the love, kind, affection, and the time spent between their relationship is not meeting the needs. Again, the arousal disorders come in. Though she wants to have a good sexual activity, the desire problem is not there. But again, at a mental level, if there are blocks, at the mental level, she's confused and she is in a complicating situation, the block itself will not allow arousals. And maybe that day fights or that day hate talks or anything that is related to a kind of abuse or inhibitions or a kind of not welcoming relationship to her. Again, though her she might not have a low sexual desire, but for this relationship, for this partner, or for this time, or for this kind of condition, she might have a low sexual arousal disorder or a sexual arousal disorder. And these kind of disorders again are very temporary, and they can be tamed, and they can be treated by counseling, by small amount of medications, by constant talking to what is the problem, where is the block that has come from, which part of the problem that you have to deal with, and if they are dealing with any kind of depression or subconscious struggles that they have, then definitely they are treatable and they can be dealt in a better way. So this is one of the type of female sexual dysfunction, where one symptom can be because of a sexual arousal disorder.